First in the group is that when we are talking in terms of management of patient's needs, there are three things that we need to do. We need to assess the patient, then we need to treat the patient, and we need to review the patient. So for the assessment of the patient, we need to take a history of the patient. It has to be a complete history assessing the patient's total pain. We need to take into account the patient's the social component, the spiritual component, the economic component, the familial component. Everything has to be taken into account when we are taking the patient's history. Then we need to do a complete examination of the patient, and then we need to assess the severity of the pain. We need to score the pain on the pain scale to quantify the pain to let us know at what stage of the pain ladder we want to come into. Then we need to assess the type of the pain. We need to determine whether the pain is nociceptive, neuropathic, or nociplastic, because based on that, we can go ahead and look at what drugs we're going to use to intervene for this patient. We need to take a look at the patient's current medication, the options that are available with us as doctors for what we can offer to the patient. And we should also look at the patient's previous history, especially if he has any investigations or any imaging done, whether that is relevant to our current findings. And based on our patient's assessment, we can move on and we can plan the patient's treatment. The treatment as we do has to be individualized based on the patient's individual needs. This is because all patients are different and there may be different circumstances for the patient which affect which drugs we are and which interventions we're able to offer for the patient. For example, if the patient's an asthmatic, we might want to avoid using NSAIDs. If the patient has renal dysfunction, we may want to avoid using drugs like Brufen or aceclofenac or diclofenac. If the patient has a history of low hemoglobin, low platelets, or of any GI bleed, we might want to avoid drugs like Brufen or aspirin. We need to take into account the patient's age and the patient's weight, because based on that, the dosages of the drugs that they're giving are going to be different. We also need to assess whether the patient has any hepatic or renal dysfunction, because based on that, the drugs that we're able to offer are also going to be different. As we said earlier, we will assess whether the patient is having a somatic or a visceral or a nociplastic pain. So if the patient is having a neuropathic type of pain, we might want to add some adjuvants. So that will also be a part of our patient's history and examination. Based on that, individually, we'll have to decide what we're going to offer to the patient. Then after we treat the patient, we need to call the patient for regular follow-up. The patient has to be reviewed. And at every reassessment, we have to reassess the pain and we have to reassess the pain score and see how effective our intervention is. And based on the effectiveness of our intervention, we can tailor the drugs and the doses according to the patient's response. If the patient is not tolerating a drug, maybe we can switch it out for some other. And the last thing that we had discussed in our group was that pain is a symptom.
Dr. Abraham, was it only that we lose?
I think he got stuck, probably for net coverage. Dr. Abraham, what was the topic again, please?
Application of pain relief to suit individual patients' needs.
Application of pain relief?
To suit individual patient needs.
Okay. Yeah. So that is individualized approach to pain management.
Yes.
Okay. So actually, you have to. So before I comment on this, I would request other mentors to comment on how to go about this.
Yes, Sunil sir. Actually, I think I didn't hear the duration of the lecture, how they're planning, for how many hours the session they will include. Was the assessment also mentioned? how they're going to assess the students, final year medical students? Like, I didn't hear.
Okay, it was more of a structure of the lecture. I don't think we had gone into those topics when we were having the discussion in the group.
Okay, actually, this is because you are doing it for the first time. We are not expecting that what you will actually tell to the student, but we only want what is the framework with which you will teach the students, because all of you are faculties and you are teaching students for so many years. So we don't want you to come with contents, but how you are going to teach the students about this particular topic. What all would be included, what all would be the teaching techniques. So those all are the things which we want to hear from you, because that would be interesting for us also, because we are also teaching. So that's what we would need. So maybe from the next presentation onwards, all of you can actually present like this, the framework. I think Dr. Sunit want to say something. Please unmute, sir. No, you are still muted. Please unmute.
Can I start my presentation?
So you are in which group?
Fourth group.
Please wait.
Okay.
Let's conclude this fifth
Right.
group.
Right.
Dr. Manish Kumar.
Yes, sir. Am I audible, sir?
Yeah, you are audible.
Hello.
Yes.
Yes, sir. So just we're talking about how to teach this topic. So it came to my mind that this is like what NMC has now introduced is vertical integration. So since this is being taught to a fourth year student, so what we need is to have clarity on the basics of the pain mechanism and the even the pharmacology topics. So we call seeding here. So before the start of the session, we can have a short quiz or so where we just brush up on the initial aspect of these topics and then go ahead with the lecture on the different scenarios. Or we can also follow up this with a clinical visit during clinical visits to a palliative care ward. We can do the clinical aspects.
Okay, thank you. Parul, would you like to go further?
Just the framework, what they have mentioned was the topic topic per se. For this topic, we can add some role plays as well, or some case-based scenarios as well, since they are in the final year. So that will be the better way of interaction of like to understand this topic in a topic well, sir. Otherwise, the session should be a pre-test and post-test. That will be one kind of assessment. And how they are going to implement it will be based on the role plays or simulation based. That will be the, they will show or they will know how kind of domain it will come in.
Okay, so each of the topics would be having and know how, show how. So I don't know which domain this topic needs. So it would be
this
given
session,
to you.
I think, so for this session, I think actually we should start off with an anchoring lecture and then maybe divide the session into small groups, give each of them a case-based scenario, and then have them discuss the result of their case-based scenario at the end of the session. Right?
Okay.
Can I ask a quick question, Abram? Like in the fourth year of students, are you primarily teaching them in a didactic situation in a lecture hall, or are you really doing more bedside teaching? In what scenario is this teaching that you're talking about? Thank you.
Well, traditionally it would have been a lecture, but now they're trying to move it into more interactive ways. So when I was studying, it would have been a lecture for us. But
I see.
now we're having case-based scenarios, small group discussions, large group discussions in the classes.
Within the lecture format, in the lecture hall, you break out into small groups?
Yes.
Okay. So what as Parul told, a pre-test and a post-test with different case scenarios, which would actually bring out the importance of individualized approach towards pain management. Maybe you can even have a there can be some script, I think, maybe some 3 or 4 scripts with the same pain score, but different types of psychosocial and spiritual issues. And when each patient is given some medicines like paracetamol or NSAIDs, they do not have pain relief. But when you address psychosocial in one patient, the patient gets good pain relief. And when you address the spiritual issues in one patient, that gives good pain relief. Financial issues in another patient gives good pain relief. So with that, you bring the individualized approach towards the patient. Maybe even you can talk about interventional pain management in one patient. So different kinds of scenario, and then probably you can summarize the session. Maybe 5 minutes on the total pain concept and why it is important to address the pain in whole, and followed by post-test. I think we can move on to the next group. Dr. Sunit was ready. Dr. Sunit.
Yes, sir, I'm presenting. Can I share the screen?
Yes, sir, you have the access.
Okay, thank you. Is my screen visible?
Yes, it's visible. Please put it in the presentation mode.
Yes, I'm doing that. So I'm Dr. Sunil Turia. The topic allotted to us is pain assessment, pain and suffering assessment, and it is for the second year students. Right? I have designed my lecture depending upon time slots on various topics to be covered. So I'm presenting this thing, and initially for the introduction, I'll spend about 5 minutes. It will be a basically interactive didactic lecture in which I'll be involving students.
Sorry to interrupt, Dr. Sunil, but your slides are not moving for us.
Okay.
If it is not in slideshow mode, maybe you can just.
It is slideshow. Can you see the slides moving?
No, sir, no.
No, we can see only the first slide, pain assessment.
Okay, I'll show here. Is it okay?
Yeah, it's moving, but can you put it in slideshow?
I put it in slides, so yes.
So I think you have to share the slideshow.
Okay, I'll leave this, stop sharing. And there is an option of share screen.
Yeah, share screen, and then you will click on the PowerPoint presentation that you want to present. So that will open, and then you have to put it on the presentation mode. There will be a glass-like icon on the right-hand side of the bottom side of the screen.
That's what I did.
So, sir, in best interest of time, maybe if this is
Yeah, you
for all
can go.
vendors.
Yeah.
So you can just keep clicking on the next slide, because anyway, slideshow is not available for us, but this is readable, I guess.
Now, can you see? No?
We can see the second slide, sir. So next you can keep on clicking the slides.
Okay, I'll
manually.
just share the screen only, don't worry. Okay, I'll spend 5 minutes on the introduction, in which basically I will try to elicit from the students by asking few questions, what they know about the pain and what they know about the suffering. Then I'll enumerate various learning objectives of my this lecture. Then I'll spend about 5 minutes on defining pain and suffering, and how they are different, how they are interrelated. So, and I'll discuss the difference between acute and chronic pain and their relationship with the sufferings. Next 5 minutes I shall be spending on by asking questions on types of pain like nociceptive, neuropathic, or psychogenic. This is not the topic for my class, but I will try to interact with the students and try to understand how much they know about the pain, and to just recollect so that they should recollect their memory about the pain, types of pain. Only then they'll be able to classify and chart and assess the pain, right? Next 2 minutes, I will share with them a case scenario. I'll not discuss, I'll just share the case scenario, read it out to them, so that in the subsequent lectures, when I am classifying the pain, their mind is thinking that which category this pain belongs to and how to assess it, right? But I will not discuss, I'll discuss it after by telling them how to classify the pain. Next 10 minutes, I will be spending on telling them various tools and methods used to assess pain, like numeric rating scale, VAS scale, or like all other scales which are used commonly, right? And I'll explain them how to use them, how to chart them, and how to infer from them that which is mild, which is moderate, which is severe pain, right? Then next 5 minutes I'll spend on pain assessment in special group of people like children, older age patients with special needs, with dementia, like neuropathic pain assessment tools, all those things. I'll spend another 5 minutes. Then I'll spend few minutes on telling them how to chart this pain on body chart, and how to use this differentiating tools for assessment of the pain. Then I'll bring back the case scenario again, and I'll subdivide the class into few small groups and distribute them the task, so that one group will analyze what type of pain this is, another group will discuss the possible causes of pain, and another group will discuss how to assess the pain using the tools I have already described. Then I will stress 5 minutes on suffering assessment, like especially in patients with special needs like dementia and all those things, and as assessment of various emotional and psychological factors for the concept of total pain management, total pain assessment. Then I'll show them a video presentation of some case of about 3-4 minutes. Then again, I'll subdivide the group into few small groups, and ask them to assess the pain and report how their assessment by charting the pain. Then I will last 5 minutes, I will let them opportunity to ask questions about pain assessment and give them answers, and I can ask the students how much they have learned, whether my learning objectives are achieved or not, and explain then how we are going to assess them for this lecture in the monthly or weekly test, whatever we have. This is how I plan to do the lecture.
Okay, thank you, Dr. Sunil. So anybody has any comments on this? Mentors?
This is for third year, sir.
This is for second year.
It's for second year.
When students are quite new to pain.
Yeah. Okay.
Anybody else? Dr. Manish?
Yes, sir. This topic can also be covered as things when the students come in pharmacology in second year, and it can be covered. The assessment part can be done through OSCE stations, and we can teach them in like simulation, some simulated patient we can bring in, and like how to assess. We can give the tools to them so that they can do it real time, and then that way they can practice it.
Okay. So can this OSCE be considered for evaluating them at the end, assessing the pain of a patient?
We can share small case histories and ask them to assess the pain. Or we can show a video in OSCE to assess the pain.
Okay.
I feel that since they are second year students, there are a lot of number of students, so I think dividing them into small group discussions would be a little tedious. So I think rather than that, for a second year student, probably I think we can incorporate problem-based learning by doing a case-based lecture. We can, in the PPT format only, we can give them cases, we can give them some time, so that they can think, and then it can be made interactive. Because I feel that the teaching methodology by and large depends on the number of students that we have to teach. If like in our college, we have a batch of 200 students. So it is very difficult to divide them into small groups. So I think the first year and second year.
By dividing a small group, I meant that say right side, left side, middle group in the whole class only.
But all of them will be handling the same problems.
Yes.
Same problem.
Second year, we usually take a didactic lecture. So I was trying to basically make them interact.
So case-based lecture is nothing, but it is just a application of the didactic lectures.
Yes.
Even if we divide a batch of 200 into, let's say, 10, logistically, it will be a little difficult, that within the LT, they'll make small groups. And I feel more than the discussion, there'll be more noise.
I agree that the teaching and learning techniques should depend on the number of students. So if there are a lot of students, then it would be really difficult to have multiple groups. So maybe a case scenario projecting to the board and asking them, maybe there will be some buzz going on, but getting the points from them would be one thing, and another maybe one student and maybe a student can act as a patient, and the faculty can act as a doctor, and then explain them how you do pain assessment, and that would be something which all of them can see. And there are videos available in the resources that we have shared, how to assess pain. That might be another method of showing them how to assess pain, which includes from the starting about pain and assessment, all the physical, psychological, social, all those are there in that resources provided to you. So that might be something which would be very, very helpful, I think.
Yes, sir.
Dr. Sunil, I want to add one thing.
Yes, please.
In my experience of teaching, I have realized that whatever things you do for them, sometimes they lose the connection with you. And to make them always be on their toes or to be a part of that session or the class, you have to make it interactive. They
Yeah.
should know this thing that anytime they can be asked the question. So unless we make it interactive, whatever the amount of students may be, you have to somehow make it interactive so that they get a chance.
Dr. Siga,
Videos.
you were muted for a few seconds.
Sir, what I wanted to say was that unless you make it interactive, unless the students know that they will be asked questions, they might lose the track of the class. They may get lost somewhere. So if we show just videos, it may be a movie. If you show them a movie also, somewhere they will lose the track of the things. So everything can be integrated, but for small time. But at the same time, students should be aware that they may be asked to answer the question. They have to be on their toes every time in the class.
Okay.
So you have to make it interactive.
Yeah,
You have
thank
to
you,
carry
Dr.
them
Siga.
along
Yeah.
with you.
The videos which we have given, it only lasts for 8 to 10 minutes. So that's all. Actually, you can, there are some triggering videos which may be lasting for only 3 minutes, but these are actually assessment videos, maybe for 8 to 10 minutes. So that they need to concentrate only that much time. And then after you can actually ask them what's their opinion about the pain assessment. How was it done? Is it in the right way? Was there any point missing? So this would make it interactive. Yeah. So shall we move on to the next team?
Yes, please. Pratiksha, I think you can tell us.
Yes, ma'am. So can the group be present?
Yes, please.
Yes, sir. Good evening, everyone. Our topic, our competency is pharmacological drugs and their use in pain management. And this is for a second year student. So we would like to divide this competency, as they're already in the second year, they're studying pharmacology, into a total of 8 hours. Where we'll have a pre and a post test on the competency of half of our each. That will constitute 1 hour of our total competency. In another 1 hour, we'll help them define pain and the pain pathway and the WHO pain ladder, so that we can later on teach them how drugs that we are going to teach them work in accordance with the pain ladder. Then we will start our lectures on NSAIDs. That will consist of 2 hours. The total time given to NSAIDs will be 2 hours, in which we'll teach them the mechanism of action, the types of NSAIDs, the doses, and the advantages and disadvantages, and how they are prescribed. Same will be done for opioids and adjuvants. However, for opioids, again, we'll be giving 2 hours. And for adjuvants, we'll be giving 1 hour. 1 hour of the competency we are going to keep for large group discussions, so that whatever queries or discussions they want to have, they can have interactive sessions on them. So that will give us a total of 8 hours in the second year MBBS curriculum for pharmacology and pain management.
No, we had also said, no, we'll give them scenarios and they'll
Yes,
come up
ma'am.
with
In those 1 hour discussions, we can give them scenarios where they can prescribe drugs and doses based on the need of the patient and the WHO ladder.
Yeah, true.
Okay. So actually, from the next time onwards, I think you should not look at the time, total time for that year. So you told it is 8 hours. So what we actually want is you would take one topic from this, and then you will actually come up with teaching methods. And that's what we would like to hear. Suppose if it is opioid that you are going to select. So how are you going to teach the opioids to students? So that's what we want to hear. Okay. Yeah. So thank you, Dr. Pradiksha. And I think that we can move on to the next group. Group 2, I think.
Dr. Lakshman.
Is he not there?
I can't see him now, sir. Any representative from group 2 who would like to take up?
He was there during discussion.
Yes, sir. Anyone else who was part of the discussion can take up if they want.
Hello, this is Dr. Jyoti, sir, from group 2.
Okay.
If it is okay, shall I?
Yes, yes. Please come.
Yes, sir. Our topic given was the principle behind multimodal approach to pain relief. This is a class of 1 hour duration for class year 1 MBBS students. As ideally, on an average, there would be about 150 students in a class, and going by their they'll be very new to the concept of pain in first year of MBBS. So, and going by the title, I believe this would not be the first class of their set of classes for pain. So I would like to concentrate on my topic today. So I would like to have after taking the attendance, I would like to have a brief recap of what the concept of pain is, pathophysiology and classification, which would be about 10 minutes. After that, I would like to have a pre-test on the concepts which are already discussed and a few questions about what is going to be discussed in this present class, which would be about 10 minutes. Later, I would like to discuss on factors modifying pain and different scales to assess pain, which would span to about 5 minutes. Next, the WHO pain ladder. And here itself, I would like to stress on how pain affects the individual in different ways, like their work, psychological factors, and occupation and financial independence, and also spiritual factors, so that the first year students will try to think about different dimensions that the pain has and its effect on the individual. So this would be a brief discussion of about 10 minutes. Later on, I would like to present a few case scenarios, about 3, each depicting different effects of pain which it has on an individual. For example, in the first case scenario, I would like to state how pain can affect the occupational as well as financial independence of the patient. And in the second scenario, how it psychologically affects the patient. And the third, similarly, his spiritual well-being and his dependence on his family members and etc. So that they would like to, they would be motivated to treat pain in a multimodal approach. So this would be about 10 minutes duration. And the final 15 minutes of discussion would be different multimodal approaches, like because they are just in the first year, not much of, but I'm sure pharmacology, and then different multimodal approaches like supportive care, mainly the education, communication skills, how to break bad news, as well as how we can support patient through his journey of the pain and palliation if any, and also counseling in various forms like psychological counseling, physiotherapy, dietitian help, and also finally the supportive care as well as occupational support what we can give to the patient will be discussed. This would be for about 15 minutes. And finally, we can have a post test of 10 minutes duration to assess what the students have understood in the class till now.
Okay. Anybody else have any other ideas? Anybody, mentors? Any of you have any comments? Okay. So, yeah. Somebody
Sorry
speaking?
for the background noise. Yes, sir.
Parul?
Sorry. Yes, sir. I was just, it's my opinion. I found that.
Okay.
Parul, you muted.
Oh, so sorry. Yeah. So I
Parul,
was
were
saying,
you talking?
sorry.
Yeah, please go on.
Yeah, I'm talking, sir. Yes, sir. Yes, sir. So I was saying that the topic which is given to the first year, the subtopics which is mentioning are too extensive. I found it a little bit more extensive for the first year. It should be more in the simpler terms.
Your voice was not very clear for me. I don't know for others.
I was able to hear her. She said that it should be presented in simpler terms. Since this is our first year students, she said that it should be presented in simpler terms.
Okay. Yeah. Thank you. Yeah. Parul says it is too extensive for first years.
That's what I wanted to add on. She felt that it
Yeah.
was too much for the first year, I think.
So what all should we include in the principle behind multimodal approach to pain management? Anyway, pharmacological management cannot be covered, but you can cover the non-pharmacological management.
Even, sir, we can, apart from non-pharmacological management, we can even talk about WHO ladder.
Yeah.
Because it's quite famous. Just an introduction to WHO.
Yeah.
That
Can be done. Yeah.
Just giving a heads up that one type of management will not help. So just to say what is total pain and then just pharmacology alone may not help. Just to put that seed in to say, because generally they may think that when they are in the first year that for everything medical management is the only option. So just to tell them or put that idea that multimodal option is there. So just to give an idea of multimodal management will be very important and useful, because to tell them that option in the first year itself, so that when they get to final year, they will really know what is multimodal.
Yeah.
Yes, ma'am.
So actually, Dr. Jyoti described about various case scenarios, which indicates the importance of addressing those problems.
Yes, sir, exactly my point. Even first year students wouldn't be in a position to understand the different approaches if we deal in detail to them. Like the pharmacology step 1, step 2, step 3, they wouldn't understand. So I'll just give a brief introduction to pharmacological management of the pain, as well as proceed with the different other modes of management which has to be dealt in order to treat pain in a wholesome manner. That would include counseling as well as other methods which we can use to support the patient in order to make him functional as much as possible. So that is why in order to manage pain in all these approaches, I wanted to add a few case scenarios depicting how pain can affect a patient in different ways. So that would take more time than the actual management part.
Okay. Okay. So I think we can move on to the first group now.
So the topic given to group 1 is dimensions of pain, and we have to teach it to participants. So it will be a lecture of about duration of 30 minutes, where we will use first 20 minutes to give them a lecture using PPT presentation, in which we will give them the definition of pain, the pain pathway, because they've been introduced to physiology and anatomy, the pain pathways, the nociceptors, the importance of limbic systems, and then the various dimensions of pain, the total pain that we will tell them. Then, in order to make them understand these dimensions of pain, we can incorporate small videos to make them better understand all these components. At this PPT should take around 20 minutes, and at the end of PPT, we will discuss certain clinical or real life situations which the students have faced in their life for about 5 minutes, so that they can correlate the lecture with the real time or the real life scenarios. And this should take 5 to 10 minutes. And at the end, the last 5 minutes, we can give them MCQs to assess their understanding of the dimensions of pain. Total of 30 minutes.
Okay. Anybody has anybody has any comments?
So one comment I want to make, the
Yeah.
problem with having an interactive session, especially when the classes are large, is how time consuming it is going to be. So if you have a class of like 100 students, 5 minutes for discussion, how interactive is it actually going to be? That is somewhere the earlier lectures are a little easier, because at least you can be sure that you've got all your points across. If the problem with the current system is, I'm not sure how we are going to actually get it across with the discussions and all. If the smaller group, it is always possible, but with a larger group, how are we actually going to have like a discussion? And that was what I wanted to actually just ask.
I feel this is the drawback of the, lecture-based teaching. But in a large group, there is no other way, rather than the lecture. But then in a class of 200 students, when we ask them to, share their experience or anything like that, not everyone, come up. So we don't feel that, I have never encountered a scenario where, we have asked somebody to share an experience, and so many have come up. In 200, I think not more than 3 or 4, they get up and they, share their experience.
Okay.
And as I discussed before also, nowadays the case-based lecture, is a very good alternative to the didactic lectures, where, you incorporate, you start your lecture with a case, and then you come to the definition of pain, the pain pathway, and like that, So it is a very easy way of incorporating the problem-based learning, in the lecture-based method of teaching.
Yeah. Thank you. I found it always useful to have a case scenario first, followed by the discussion on that patient, and at last coming back to the same patient and ask them again. So, so there are various methods. So all of you are experts in the field. And Sripriya, are they going to be in the same group for the next session?
Yes, sir. Yes. Tomorrow and day after tomorrow also, it will be the same group. Only the topics will differ.
So I would request the group. So now you can understand what we are expecting from you. It's only framing how you are going to teach the students. It is not the actual topic that you are going to teach them. So what are the teaching techniques that you are going to use? You can also go into the various topics, resources that we have shared. There will be videos, even PowerPoint presentations are there, other materials are there. So please go through that and plan for the next session. Yeah, that's all. Any other comments from mentors or anybody else?
So about teaching methods, I think the three steps could be, the first one is most of our lectures, they have a didactic part or the adcom part, and let's consider the student is absolutely fresh. So first thing should be the didactic or the adcom part. Then the second part is the technical data, like in the WHO ladder, first, second, thirds, the opioids, which are naturally occurring, which are synthetic. And about this, I would say I tried this thing. I gave them the slides on WhatsApp and I asked the question. I said, this is going to be interactive. It was a small group of about 20 students. And I said, ask single word questions. And I said, the answer is in your slides. So I said, any of you can answer it and raise your hands. And if you can't, if you can't answer, if you can read the slide. And that way, I think their involvement is very genuine, because once you give lecture, someone was saying they can go off track, they can go lost somewhere. Once this technique is used, that you ask them question and they know the answer, they don't know the answer, you tell them the answer is in the slide which they have been given, or the slide can be on just one big slide for everyone. I mean, on the class boardroom. So that way their involvement is absolutely genuine. When they read it and find the answer, they remember it. This is a technique. And the third thing I would say should be the sort of case discussion. Because immediately first thing, if you do to a case discussion to a fresher, then I think it's like a bouncer. The first thing should be the didactic or the adcom part. The second is technical data. That these are the things in which I have told the technique. You give them the slides and ask one word questions. There can be 60, 70 questions important. So that will make them itch in their mind. This is the technical data they need to remember. And the third thing can be the case presentation or the case discussion scenario. Thank you.
Okay, thank you. Anybody else? Okay.
One of the technique which I use to make the class interactive is I just go through the attendance and randomly call out few numbers and ask them questions which are clue to the next topic, piece of information which I'm going to give. And this will create an interest in them in order to know what they actually will be taught next. So I usually do that.
Okay. So Priya, I think we can wind up for today. It's over to you.
Thank you, sir. Thank you all the esteemed members, Dr. Radha, Dr. Punitha, Dr. Parul, Dr. Sunil, and Dr. Sreedevi for spending your valuable time giving your suggestions and inputs. I don't know, maybe I felt that the session, because the topic was pain, it might have been a little bit painful for many to start with. But I sincerely hope that tomorrow, since it is communication, more people will come out and communicate. Because all I could see was more blank screens over here. The vendors might have also felt the same. So with a promise that we'll be meeting again, the format of the sessions would be same. Maybe one or two members might get changed. So hoping to see you everyone tomorrow, same time. This is Sri Priya along with all the esteemed members signing off from the Tips Eco Hub. See you tomorrow. Till then, everyone, take care. Bye-bye.